Good afternoon. First of all, I hope you're well. Today, I will present you our study entitled Perception of Specialist Nurses on Practices in the Promotion of Autonomy for the Elderly, a phenomenological study, considering the concept of autonomy multidimensional as it encompasses skills such as cognitive capacity, intellectual capacity, emotional intelligence, social situation, and physical capacity. The importance of nurses' understanding is understood. The latter are responsible for promoting and maintaining the autonomy of the elderly through diagnosis, implementation, and evaluation of the interventions that respond to the needs that autonomy addresses. This investigation aims to describe the perception that specialist nurses have on the practice of promoting the autonomy of the elderly. The reflection of practice, that is, of reality, is the first step towards change. It is a qualitative study using the principles of the phenomenological methodology of descriptive type to know the structure of the phenomenal and the meaning of the experiences lived by specialist nurses in the practice of care with regard to the autonomy of the elderly. Data were collected between March and December 2018. Participants were recruited from two health institutions located in the north of Portugal. In a total of 18 specialist nurses working in internal medicine, surgery, and orthopedics units met the inclusion criteria and were therefore invited to participate in the study. All interviews were audio recorded and transcribed in full. The interpretation of the information obtained was carried out through thematic content analysis according to Bardin. Atlas T software version 8.4 was used to systemize and catalog the analysis material. This is the characterization of the sample, mostly women with an average age of 49.6 years and 16.3 years of professional time, all specialists and most specialists in rehabilitation nursing. 8 categories emerge from the data analysis. Use of instruments, use of theoretical framework, nursing focus, nursing diagnosis, prescription of interventions, execution of interventions, nursing records, and working conditions. The main conclusions of the study were: the study made it possible to understand how nurses in clinical practice work on the elder's autonomy. Specialist nurses essentially promote physical autonomy, however, they recognize that working conditions are conditioning factors for the promotion. An important limiting factor in this promotion is information systems, as they only allow the promotion of physical autonomy, since other nursing focuses, diagnosis, and interventions that cover the scope are not parameterized within the scope of autonomy of this concept. Thank you all for your attention. I'm available for any questions that may be pertinent.